do this problem. I found this quote in an unlikely source, because background is from HVAC refrigeration. But it says, we solve problems every day. That's what we do. And it's as much a state of mind as a skill. And sometimes those problems are things of our own making that we have to solve, and sometimes we don't like doing that. But the last part of it is, rarely is our effort hampered as much by our knowledge and skill level as it is by our willingness to engage the issue and work toward a solution. I hear a lot of times that issues like this are too big, and they are huge issues. But it's even like the chicken ordinance in Beloit. A group of people get together that are willing to engage the issue and work towards a solution. And the last quote I didn't contribute to, but that comes across every email at Concordia University. The mind is like a parachute. It only works if it's open. As Christians, I believe we need to work towards a solution by looking at the way of Jesus, looking at his teachings and how he acted towards people in his walk through life. And I said this before, but when he healed somebody, he didn't say, I can't heal you today because you don't have your copay. We can get there. But those are some of the what I believe to be some of the fundamental healthcare questions. And Kurt's going to play a little clip, and then we're going to gather around the table and see what everybody else adds to the conversation.
Premiums are out of control. I'm not sure what we're going to do.
Haven't you heard about MediShare? It isn't insurance. It's a nationwide network of Christians who save money by sharing each other's medical bills. We get to pick our own doctors, and our share is almost 40% less than our old premium.
Well, what about the new law?
Well, MediShare is a health sharing ministry, which makes it exempt from the health reform laws.
If you're a Christian and a non-smoker, log on or call to see how you can start saving on healthcare today.
It's kind of interesting. I didn't have much time to think about that, but there's lots of people looking at lots of different solutions out on the market, but you can see some of the things that might be right about that or good about that, but I don't know if some of you picked up on the fact that there's no dollar numbers mentioned there, 40% less. It's still a system that's based on the ability to pay. It's still based on money. So that was my only comment about that. So go ahead and I'll let him take over and let you gather around.
We might just kind of gather on this. We'll be more Jewish with each one. If you want to kind of listen with these seats in here too, if you're on the table. So we kind of gather closer together. That'd be wonderful. We hope we understand Jesus was about his people of faith. So we'll do like three-ish. Yeah, three-ish. Just make sure that no one's left out. Have a little discussion about what you thought of, what your feelings are. You guys can have your own group here too. Yeah. I'm waiting to answer questions.
And they usually send her but they find that the case not always guaranteed to get one. Right. And what's ours, yeah, because
it's still the same.
And now we have to get proof. So you have all
all of these people who have jobs, and now we're going to have to pay them unemployment from the money that we don't have. Well, but honey, you know how many people?
Yeah, that's so hard too because you're sort of taking the same stand they are.
How many people?
Yeah, that's the thing. Is that, you know, I don't know. That's kind of a tough one there. I don't. These are all anecdotal that I've heard of. Why
don't you take like 30 seconds to draw out your thoughts to a conclusion, and we'll kind of share as a big group. And Wayne will be here to answer
Solve
questions.
the world's problems.
Solve the world's problems. Any thoughts, Ted?
I don't know how they do something like Canada. But I don't know what they pay for taxes up there to make healthcare so great, which they say it is.
It doesn't sound like they're paying more. We are, in fact, what it sounds like they're we're wasting so much.
Well, we're wasting a lot of money. I mean, somebody's getting rich off that. Yeah.
The Lord be with you.
I mean, this is real touchy, because on this side you have doctors, that need to take care of their families and things like that. Then you have people that can't afford, the prices that these guys have. So somewhere in between, you have madness. Grandmama gets sick. You got elderly, you got kids that's dying, But one thing I can say is America is not as bad as a lot of those third world countries. So I personally think that, like with me, I don't have health care. I don't pay for the insurance for it. But if I could afford it, I would. But I just try to look at the fact that, here I'm here, and we have a lot of rights here that others don't. So I just take it in stride, and leave it in God's hands. And if it's His will, things will work out.
So, we were talking about.
Say it again.
Canada believes on their people.
Yep.
There's a lot of
free medical.
What are you saying? Yeah.
So if you look at nature as a whole, and please don't, whatever, if you judge it or say whatever, but if you look at a herd, the sick are the ones that get left behind and are the ones that are on the outside of the thing to get picked off first and eaten first, and the healthy ones are in the center. And Liz and I are a big component on homeopathic. There are homeopathic doctors that you can go to. There's a woman that we know who talks about healing cancer and curing cancer. We have a friend of ours who, his uncle was a homeopathic cancer cure in Madison. He cured cancer. His pharmaceuticals companies came to Madison and they pushed him out. Now he's a venture capitalist and he gives money to people to empower them. So it's just like everything else. We need to look at farmers for our food locally, and we need to look for our homeopathic doctor locally. And obviously they're not going to be able to cure everybody, but a lot of the things that we get sick from and that the reasons that we're sick is because of the chemicals that we put into our body, and that's a really big part of it. And if you look at Moses and how old they all lived, they didn't have the chemicals back then that we do now, in the air, in the water, and the food. That is such a big thing. And Wayne was talking about, the weight thing. It's not all about weight because everybody's body is different and their weight for their body is different. But it really, a lot of it is the chemicals. So we're putting chemicals into our body all day, and then we're putting more chemicals in there to fix those chemicals. And so it's just this continual cycle. And just one more quick thing before I go. In order for our healthcare system to be completely fixed, it's going to have to fall and crash. And that is going to unemploy all of those people who are right now employed by the healthcare companies. And so unless you can immediately find jobs for all of those people, that's going to go on into our unemployment system, which is broke as it is. And then we're going to have to try to pay that, to reimburse those people for losing their jobs. And so it just, as a whole, it has to, it has to be like the Roman Empire. It just has to crash. But are we really prepared for that? Are you ready? Am I ready for that? I don't think I am, but that's Newton's law.
I just want to touch on what he said. it makes a lot of sense because if you look at the Titanic, they made this big ship that hit an iceberg. It was too huge to repair, so it sunk. Now look at the ships they make now. We have it's messed up that it has to be this way, but we go through things and we learn from our mistakes. And that's how it has to be.
One of the things that really has struck me in this journey is that many other countries, I mean, we spend the most, and the delivery system is inefficient, or the payment system is inefficient, and yet we get out of that system much less than any other developed country in the world. So, in those countries, the basic assumption is, and it's part of their constitutions, and even part of the constitutions of many third world countries, that health care is listed as a basic human right. In this country, it's not. America doesn't consider health care as a basic human right. It's not codified as a human right. And all of the funding arguments, and I had a slide up here showing what one writer calls the myths of health care. They've all been argued on the basis of health care as a commodity. So, and yes, Adam is right about the jobs involved in health care. So no matter what you do, there's going to be, there has to be a transition here. But if we sit and do nothing, it's my personal opinion that it will crack. The society is only as strong as its weakest link. And everybody is paying for it, whether you're paying for the health care for everybody. Ultimately, everybody is paying for it in lost productivity, lost, let's say there's people that want to be contributing.
We can run a system that's completely, in many ways, based on dog eat dog, but a lot of people get what they need, but a lot of people don't. So if we were running like those countries that maybe don't have the resources even to give everyone basic health care, but if we function like that, thinking that it's about we're all together as a community, we support each other, then we have so much wealth we could change that. I mean, I want to see that people you're talking about end up with jobs and stuff. It's like, well, right now they're making money in this essence doing nothing. So why not let them make the money doing something instead? You use it to change something.
Right. That's kind of tied into our historical context of America, because we have this rugged individualism that has come all the way through our history. We're not a communal culture, community-minded culture like that of Japan or some of the other Asian countries. It is, pull yourself up by your bootstraps. It's the bootstrap mentality. And yes, there are people who do have choice, but do people choose to come down with a chronic illness? It's more complex than similar choice.
I mean, we can kind of try and cover, because as a nation we have so much wealth. Some people get it, so we can say, oh, look, we're doing something right, when we're really not doing anything. We just kind of cover.
So we're part of it. We need to work with others in broader places, because you want to talk about healthcare, it's just like education in one sense of some things are so big that it has to be the bigger community to do it. So this is just a little stepping stone in that, and we want to, I think, really explore together, and not just in talking, but in how we do things, how we can be a greater witness of what it means to live deeply as God's people, to live as followers of Jesus, to try and do the things Jesus did to create healing and reconciliation and a new model of how we can be community together. So why don't we close this time with prayer? The Lord be with you. Why don't we hold hands like we like each other? We're all together.